A major healthcare disruption is unfolding at the Kenyatta National Hospital after nurses downed their tools over long-standing grievances. The strike, which now threatens critical services at the country's largest referral facility, stems from disputes over pay, staffing and working conditions. Susan Waweru reports.
Operations at Kenyatta National Hospital have been thrown into disarray as nurses down their tools, accusing the management of neglecting their concerns despite prolonged engagement. The nurses say they have exercised patience but can no longer continue working under what they describe as unfair conditions. At the heart of the crisis are claims of understaffing, poor medical cover, pension challenges and delayed or inconsistent pay.
Ukienda pala ICU ambayo inatakana kuwa na mgonjwa mmoja kwa muuguzi mmoja, muuguzi mmoja anapewa wagonjwa wanne. Kwa hivyo kazi imetuzidi na wagonjwa wetu hawapati matibabu kwa kiwango ambacho kinastahili.
If you want to see a specialist at the daycare here, you will have to pay 2,800 from your pocket. Yet we are told we have a medical cover that has everyone was designated from 1.8 million and above.
Union officials revealed that talks with hospital management have dragged for a year without tangible results.
Last year in May, we issued a strike notice by our General Secretary. The government directed us, the parties, to go before the conciliator, who was duly appointed. We appeared before a conciliator. We agreed, the employer agreed on how to pay that money, the two allowances. After the agreement was forwarded to SRC, SRC objected and instructed the employer and the union to include the two issues in the CBA of 2025-2029, which ought to be concluded by now.
The nurses also cite financial strains caused by delayed salaries, with some now facing legal action from lenders.
Some of us, actually majority, me being one of them, have been served by the bank. They have forwarded my case to recovery agencies. So you see, it is not something that we can just keep quiet over it.
If they will not listen to us, the next level is the State House.
Meanwhile, the hospital management maintains that progress has been made on several issues and urges patience as negotiations continue.
The only item that was remaining was the issue of SRC, conclusion, which actually even you guys and Kudeya are all in court on that issue. And there is nothing we can do with an issue which is actually in court.
The acting CEO also revealed plans to transition dozens of contract nurses to permanent and pensionable terms.
I actually brought on board about 50 nurses on locum, and they're already here helping us in labor ward, helping us in small areas. Just hold on. Just let me finish. 58 nurses who were on contracts we have already got approval. We are going to place them on permanent and pensionable.
As the standoff continues, patients remain the hardest hit, facing delays, uncertainty, and reduced access to care, while the outcome of the next round of talks could determine whether services resume or the crisis deepens. Susan Waweru, NTV.